Hi, I'm Dr. Hansen. In this video, I'm going to talk about genetic testing for breast and ovarian cancer. Breast cancer or ovarian cancer that runs in the family can mean that you are at increased risk of developing these cancers. It's sometimes possible to detect if you're at increased risk by doing genetic testing. So what exactly is genetic testing?
Cancer develops because of mutations in one or more genes. Most mutations that cause breast cancer are acquired mutations, meaning they're not inherited. They develop through one's lifetime. They can be caused by exposure to environmental agents like radiation, chemicals, including those found in tobacco smoke, or viruses. They can also develop without a known cause. Most cancers, including breast cancer, are caused by acquired mutations. About 5% of breast cancers are caused by mutations called BRCA1 and BRCA2. These mutations increase the risk of developing breast cancer and ovarian cancer. Most genetic testing for breast and ovarian cancer analyzes these two genes for mutations. The test is done on a mouthwash sample to obtain cheek cells or a sample of blood.
So who should consider doing genetic testing?
Genetic counseling and testing should be considered for women who have multiple close family members that are affected with breast or ovarian cancer, particularly if the relative was diagnosed with cancer at an early age, less than 50 years old. Close family members include mother, sister, daughter. Close family members can include men with breast cancer as well. A close family member with more than one cancer, such as breast cancer involving both breasts or breast and ovarian cancer. Multiple generations of close family with cancer, like grandmother, mother, and sister. Family history on the father's side is as important as the mother's side. It's also important to know the cancer history of your cousins on both sides of your family. Other cancers in addition to breast and ovarian cancer in women can be suggestive of hereditary cancer. For example, it's important to know if there are relatives with pancreatic, prostate, colon, or male breast cancer. BRCA testing should be initiated with an individual who has cancer whenever possible. Usually this would mean testing a woman with ovarian cancer or breast cancer diagnosed at the youngest age within the family. If a mutation is not found, it's often not helpful to test family members without cancer.
So let's talk about the genetic testing itself.
Before you have genetic testing, you must think about the medical, emotional, practical, and financial effects of testing on both you and your family. You should discuss these issues with a certified genetic counselor to understand what is involved in genetic testing. A list of certified genetic counselors and their phone numbers is available through the National Cancer Institute, which can be found online. Because the BRCA genes are large and include hundreds of different mutations, testing can be expensive. In the United States, most health insurance companies will cover most of the costs. Your doctor or genetic counselor might need to write a letter to explain why the testing is needed. Many people are worried about how the results of genetic testing will affect the chance of getting health or life insurance in the future. In the U.S., there's a federal law known as the Genetic Information Non-Discrimination Act, or GINA for short, which prohibits health insurers and employers from using your genetic information. This means that employers can't deny you a job or fire you because of the results of genetic testing. This also means that health insurers can't use genetic testing results to deny you coverage or set your insurance rates. And it also means that employers and insurers can't require you to have genetic testing. The law does not have provisions for disability, life insurance, or long-term care insurance. In addition, GINA does not apply to individuals in the military. State laws may provide additional coverage. During this meeting, you can discuss your test results, ask questions about what the results mean, and ask what you can do to decrease your risk of cancer. If you test positive for BRCA1 or BRCA2 mutation, talk to your family about the results.